Konnichiwa. Konnichiwa. I hope today finds you well. And you're an awesome person. See, that's my compliment system. Sorry about that. That's bad dad humor, isn't it? So, continuing on, this section will be on inflammation. Inflammation is an immediate, local, and non-specific response. That means a lot of different things can cause inflammation, injury, infection. So it's not any one thing that can cause it. It is localized to a particular area, and it has a rapid onset. It occurs in the vascularized tissue against a variety of stimuli, like a scratch, a bee sting, poison ivy, a splinter, or overuse. And I'll elaborate on that a bit too. And it's a major response of our innate immunity. So I don't know what else to say about that. It mobilizes the innate defenses to rid most infectious agents away from the body. Most, but not all. So the first step of inflammation is that the inflammatory chemicals are released. The major one is histamine, although there are others. These chemicals are released from circulating basophils, fixed mast cells, and sometimes the infectious organisms themselves release chemicals that begin the inflammation process. And in this section, I've talked a lot about this along the way, so I'm not going to elaborate too much, but we know that it causes the vasodilation, which increases capillary permeability, so more fluid from the blood leaks out. Along with it comes the agents of the immune system. And but what I haven't talked about yet is stimulates the endothelium expression of molecules called cell adhesion molecules. And this is like a little flag waving that tells the white blood cells, hey, you need to come here. This is the place. You're in the right spot now. Hang on to this. And that's where they'll exit the circulation by diapedesis and enter the tissues. So this is margination, is the white blood cells adhering to these cell adhesion molecules. I like this example, like cellular Velcro. It makes them stick to the normally very smooth endothelial lining. And then, of course, we know what diapedesis is already. And we know what chemotaxis is. So cells going along the chemical gradient to the source of either the damaged cells or the pathogens, injury, infection. I mentioned that before. And may not release chemicals that induce fever. So the increased capillary permeability allows more fluid to move out. That fluid is called exudate. Exudate. The movement of fluid out of the capillary. That reminds me of a Bob Marley song. Dun, 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 dun. Exudate. Dun, 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 dun. Movement of the fluid. All right, I'll quit singing. Sorry about that. But it really does. That's the Exodus song, Movement of the People. So this fluid with it, everything comes that we need to fight the whatever's going on in the tissues, which can also include antibodies. That raises the pressure in the hydrostatic pressure of the tissues, making the fluid wash the tissues and increases the amount of that goes into the moves into the lymphatic capillaries that can be dealt with at the lymph nodes. And here we are, the usual suspects, along with dead cells and cells that may be injured or pieces of them. Within 72 hours. How many days is 72 hours? 3 days. So the inflammation should only last a couple of days, 3 days. The cells go, everything starts to go back to normal. The macrophage begin the cleanup of the affected area. They are the cleanup crew. And dying neutrophils that have phagocytized bacteria and given their lives for our defense. Fibroblast, there's an injury, fibroblasts, right? What's a fibroblast do? See if you can figure out what that word means. Fibro, fibers. What does a blast cell do? Gives rise to fibers. So they synthesize collagen fibers to repair the injury. That's what we call scar tissue. Doesn't get replaced with the cells that were there. It gets replaced with the collagenous scar tissue. The cardinal signs of inflammation. Okay, cardinal signs. That means, hey, these are the usual signs, the main indicators. Redness of a tissue area. That's the increased blood flow. Heat, increased blood flow. Swelling, the exudate. Whoops, sorry, I couldn't help myself. Exudate. Pain. Now, what happens is as the area that's inflamed swells, it puts pressure on nerve endings, and those nerve endings then relay back to the brain, hey, there's something going on here. Pain is nature's way of telling you to pay attention to a body part. Pay attention to a body part. So unless you're getting the manicure, no, that would be a pedicure. How often do you think about your little toe? Only when you bang it on, right? The little toe, and its purpose is to find furniture in the dark. Man, that hurts when you bang it, doesn't it? Loss of function. So if the swelling is enough that you might lose, say, you might lose range of motion in a joint. Acute. This whole thing starts going away it should go away within 2 weeks, a week to 2 weeks. But in chronic inflammation, it lasts a lot longer. All right, so I like this picture. It's a nice picture. Here's a kid on a skateboard. Kid don't look too happy, do they? Skint the knee. Well, you know what? Skateboarding is inherently unstable, and if you had been wearing knee pads, gloves, and elbow pads, you wouldn't have skint your knee, kid. Skint my knee a few times, skateboarding back in the day. So here we got a cut. These little green things represent bacteria. In this case, this is a rod-shaped bacteria, the bacilliform bacteria. So they come in, the breach. Now what we have here is a breach of security. The skin has been breached all the way down into the dermal layer. So the mast cells, there they are, right near the nearby circulatory system, blood vessel. They release the histamines, signal molecules. That induces the vascular changes, vasodilation, increased capillary permeability, and then these little hook things here represent the cell adhesion molecules. So that causes the margination. Let me see if I can talk. Margination. The white blood cell grabs onto the cell adhesion molecule, and then it can squeeze its way through. Here it is. It's a great diagram there of diapedesis. And then this would be a neutrophil in this case, finding its way to the scene of the issue where it can begin phagocytizing the bacteria. And plasma proteins, perhaps maybe even antibodies coming out. This not showing it really, really well, but fluid leaking out of here, that exudate, then washes a lot of this stuff for the debris, the bacteria, into the lymphatic capillaries, off to the lymph nodes we go for processing. Fever. Well, that's in the news today too, isn't it? Abnormal elevation of body temperature, at least 1 degree from normal. What's normal body temperature? 37 degrees Celsius. What does 37 degrees Celsius mean to Americans? 98.6 or thereabouts. So a fever, a temperature of about 100 is going to indicate a low-grade fever. That'll cause you to sweat more than usual, so you need to increase your fluid intake in response. Risks of a high fever. Fever is helpful in the immune response, but it can also be its own problem. If a fever still gets above 100 degrees, then it's considered significant. If it gets above 103, it says here in children, maybe 102 and a half in an adult, it's time to think about doing something. Ibuprofen, aspirin will help. Tylenol is a really good anti-inflammatory. And if those don't control the fever, at that point, it's time to seek medical attention. Anything higher than 103, it's definitely time to head to the doctor. Denaturation of proteins. If we get the temperature high enough, we can cook ourselves, literally. Possible seizures, possible Dane damage above 106. Yeah, that's what I said, Dane damage, sorry. Brain damage. And at 109, yeah, you're pretty much dead there. So you don't want to get that high temperature, that's for sure. And so seek medical attention before it gets that bad. If somebody's got a temperature of 104, that's a serious, serious issue, and you should be in or headed to the ER. Or call 911. Really could drive somebody to the hospital. Look at this. Let me ask you this. What will a small child put in their mouth? Right? Anything they can get their hand on. Here's a little kid eating a plastic block. That's it. You get a kid a toy, and what do? They try to eat it. So now a lot of parents will be like, no, I want to have a sterile environment. And it's in the current conditions with the COVID virus, it's hard to argue that in general. But if you have no reason to think that COVID is in the environment, this is actually a natural thing for children to do. They're born with, and this is at the very end of the section, the chapter, but they're born with very little in the way of defenses. They get some. They have innate immunity, like we're talking about, but they don't have anything specific except some of the antibodies they might have gotten across the placenta from their mom or in the mother's milk. And the immune system is really, the more you test it, the stronger it gets. The more insults that the body is exposed to, the stronger the immune system will get. So this is actually a good thing. And if you want to over sterilize, you spray everything down, wipe everything down, try and keep your kid in a sterile environment. Research does show that if you start a statement out by saying research shows, people believe you. But research really does show that people who have been coddled in sterile environments, children, grow up to have more allergies as adults. I don't know, allergies are no fun, are they? Where's my weather radar? Looks like it's going to storm outside. So, as weird as this, now I wouldn't take the kid out into a cow field or area, that's talking about a living room, maybe a backyard if you don't have dogs. Be reasonable about it. So let's see. Then we get next fever and inflammation as the second line of defense. Here's some rather complicated diagrams, but we see the macrophage doing this diapedesis thing. This diagram doesn't show the cell adhesion molecules. Here is the perforins popping a cell. Here we have we got here. Oh, boom! This person's got a parasitic worm, so the eosinophils are after it. Up here, the basophils releasing the histamines inside the blood. And here we have, so this would be a virus-infected cell, and we're going to secrete some interferons. Nice little diagram. There you are, pus. Dead, destroyed pathogens, dead white blood cells. It's pretty much the aftermath of war. Now, what can happen is it can get walled off. If it doesn't get reabsorbed, like it would most naturally, or if it's on the surface, pop like a pimple. That's what pus is in a pimple. It could form an abscess. That's where there's the body walls it off and puts it into a container on its own, and that may not resolve itself, and then sometimes requires surgical intervention to remove. I've talked about that Dr. Pimple Popper, whatever lady. If you haven't already looked at some of that, look her up, and there's some pretty disgusting videos for your enjoyment. For an acute inflammation, like you sprain an ankle, put some ice on it. Rice, rest. It's always a good idea. If something hurts, don't use it. Rest, ice, compression, wrap it up with an ace bandage, elevate it. You sprain an ankle, get some ice, wrap it up, sit on the couch, watch some Netflix. Chronic inflammation. Longer than 2 weeks. So can occur from overuse injuries. And the two typical ones that we get are tennis elbow and shin splints. Those are from using an overuse injury. Means that your body, if that happens to somebody, their body is not ready for that level of activity. I had mentioned training for a marathon and developing new blood vessels. Remember the name of that process? Growing new blood vessels in response to weight gain or exercise? Angiogenesis. That's right. If you happen to be listening to this before you take your quiz, that's one of the questions. Good for you. Anyway, another thing that can happen is people get all excited. They're like, "Ooh, I'm going to run. I'm going to." And I've seen this a lot of times. You might say, "I'm not running a marathon." Oh, that's okay, but I've seen this lots and lots. As a matter of fact, almost everybody who starts training for a marathon gets a little overzealous. And something that is very undervalued and misunderstood in athletic training is the value of rest. People get all excited about whether it's running, riding a bicycle, walking, lifting weights, getting on a treadmill, do whatever it is somebody gets all excited about, and they start doing too much too fast. When in reality, especially at the beginning, when somebody's first starting, after an activity, their body needs 2 to maybe 3 days rest, depending on how old they are. If you're younger, faster recovery. But then people say, like, "Oh, I'm going to train. I'm going to run. It's better for them. The more I run, the more I train, the more I lift weights, the stronger." Yeah, that's true. But you're headed for the overuse injury. And you know what? You can't tell people anything. They're just going to go ahead and do it. And I've seen almost everybody who's trained or has some sort of overuse injury. For me personally, it was plantar fasciitis, which was no fun. So the number one, and shin splints. A shin splint is a bursitis in the muscles of the shin, mainly the tibialis anterior, where it moves back and forth, and it's bursa, the protective sac, and that becomes inflamed, and then the muscle and its ligament don't move properly. It gets sticky and it gets stuck. It's lack of lubrication, and it's painful. And people hate it. But the only thing you can do for one of these overuse injuries is rest it. You start getting a bad case of the shin splints, you need to take a week to 10 days off. All right? That doesn't happen because people don't listen to you. They'll say, okay, well, I'll rest it. And maybe 2-3 days go by and they start feeling better. And they're like, oh, I feel better. I can get out there. It doesn't work that way. They get out there and they do it, and then they're right back to ground to starting again, where they're back to their shin splints, they're back to their plantar fasciitis, or they're back to their inflamed elbow. You gotta rest, and that rest has to be at least a week for a young person, maybe 10 days to 2 weeks for somebody my age. Anyway, so good luck trying to tell somebody about that. All right, well, that's the end of chapter 22A. Actually, it's 21. Chapter 21 in your book. It's 22 in the book that I got this slideshow from. And what that means is sayonara.